Hello, welcome to the Beasley Equine Podcast. I'm your host and equine veterinarian, Dr. Travis Beasley. In this episode, we're going to dive into what every horse needs every year, what we put together at our clinic called the Spring Wellness Package. We're going to talk about physical exams, the vaccines, Coggins, fecal egg counts, deworming, and, of course, dentistry. So stay tuned for all that.
Veterinary surgeon or start to come quick. Draw the syringe and give it a flick. Bring your little black bag with the medicines in. Bring the trank and the crank and the penicillin.
So we could talk about this as planning for a successful spring or planning for a successful year. We put together at our clinic what we're calling spring wellness packages because we offer these things in the spring, and it's stuff every horse needs every year to take the best care of them for routine stuff. And our spring wellness packages include a physical exam, a Coggins test, vaccines, at least the core vaccines and risk-based vaccines specific for our area, and different horses going different places. We also do a fecal egg count, and we deworm them based on that. And we also do a very good oral exam and an occlusal adjustment, or a float, as most people call it. And if they're a gelding, we do their sheath, and we offer a lot of peace of mind with this. So when a horse comes to us for one of these spring wellness packages, the first thing we do is we see the horse. We do a visual exam. You know, we may not have seen this horse since last year. After winter, we can look at weight. We can look at their feet and get a real good idea of how they wintered. And then we also do a physical exam. I listen to the heart, the lungs, the windpipe, listen to their intestines, and get a temperature. And again, just the general appearance. And this is a great time for us to talk to owners about any questions or concerns. So after the physical, if everything sounds good, we'll move on and sedate the horse for the oral exam and the teeth float. And then is a really good time for us to discuss any questions or concerns, you know, if they had any trouble this winter, if there's any little lumps or bumps we want to talk about. And it's just really good to get a good checkup every year. And we put together this package as an incentive for owners to get everything done that their horse needs. And we also offered it at a very fair and somewhat discounted price compared to coming individually for these appointments, because us, like almost every other equine vet in the country, are swamped in the spring. So when a horse comes in and we can do all this at once, we can get it done at a much quicker rate than scheduling just an appointment for Coggins or just an appointment for vaccines or just an appointment for this or that. We kind of take advantage of the horse while he's there, he or she's there. While they're sedated, if it's a gelding, we go ahead and clean their sheath and everything like that. So economically, it works out really good for our clients because they can get all this done at a really good rate compared to individually through the years, and it saves us time in the long run, so we can offer it at a bit of a discount. So we're going to kind of skim over all these things today, and then in future episodes, we'll have specifics about each thing. Like coming up, probably next week, we're going to sit down with Dr. Helbig from Zoetis and talk about the core diseases and Zoetis vaccine product called Core EQ, which, as far as I know, is the only vaccine that covers all 5 core diseases in one simple shot that every horse needs every spring. So we'll kind of skim over the surface today, give you guys kind of a good idea, maybe some conversations to have with your vet. So We'll jump into the vaccines first. So why do we vaccinate? What we want to do is stimulate a protective immune response to prevent or limit infection. And a horse's immune system has a pretty poor memory compared to other things. If any of you guys have dogs, you know that rabies shots are every 3 years. Most things with horses is at least once a year. Some things we're doing every 6 months, depending on the horse, sometimes even more frequent than that. So what do we vaccinate for? Again, I mentioned the core diseases that consist of 5 different things: rabies, West Nile, Eastern equine encephalitis, Western equine encephalitis, and tetanus. And the reason these things are considered core diseases is because every horse everywhere is susceptible. It doesn't matter their age, doesn't matter their discipline, doesn't matter their breed. Every horse is susceptible to these core diseases unless they're locked inside somewhere and you can keep mosquitoes completely from coming in. And then we also, part of our spring wellness is the flu rhino, equine influenza, and equine herpes virus, or rhino pneumatitis, whatever you want to call it. And those are kind of the risk, what we call risk-based. So there's two classifications of vaccinations in horses, two classifications of diseases. There's the core diseases, which is the 5 I just mentioned, and the risk-based diseases, which there's a ton of those besides the flu rhino, but the flu rhino is the most common one we tackle at the clinic. So one reason they're considered core diseases is, again, every horse is susceptible to them, and these 5 core diseases have pretty high mortality rates. And that means if your horse contracts it, there's a pretty high chance that he or she could die from one of these diseases, and they're preventable. These vaccines work. They're very effective. I have yet to see a vaccinated horse for rabies or tetanus actually get the disease. When we talk about mortality rates of the core diseases, so the mortality rates is, for instance, rabies is 100%. So if your horse gets rabies, it's going to die. 100 out of 100 horses that gets rabies die. West Nile virus is about 33%, so 1 in 3 die. We can save about 2/3. The Eastern equine encephalitis is about 90%, so 9 out of 10 horses can die from that. The Western equine encephalitis is about 50%, and according to the text or research, tetanus is about 75%. But most referral hospitals you talk to, most of the specialists will tell you that number is closer to 100. And part of that is because by the time it gets to a hospital, the disease has progressed and can be quite devastating to the horse. So at least where we're at in Southern Illinois, USA, all these horses are exposed to the 5 I just mentioned. We have mosquitoes. Some of them are big enough to carry a Volkswagen Beetle around. We have skunks. We have raccoons. We have foxes. And horses, they're awful curious. So, and the first thing they do is stick their head down there and look at these things. And West Nile comes and goes. But rabies is one I kind of want to talk about, which we'll talk more with Dr. Helbig. But it's pretty scary because it's transmitted through saliva of an infected animal. And not only is there a risk to your horse, but there's also a very, very high risk to you and your vet, because when we get called out to an emergency, one of the first things we'll do is look in the horse's mouth. We'll pull his gums up and see how their mucous membranes look, and we're exposing ourselves to saliva. And there's about 50,000 plus people treated for rabies in the United States every year, and about 60,000 deaths worldwide from rabies. And if you got the courage, you can look up some videos of people with rabies, and it will scare you to death. So if you care about yourself, if you care about your horse, if you care about your vet, vaccinate your horse for rabies. Horses are about 4 times more likely to get rabies than your dog. And the interesting thing about rabies is when you think about a rabid dog or an animal with rabies, you think of the drooling and the saliva and the kind of aggression and the craziness, like they want to bite you. But horses are unique, as they can get a lot of different signs from rabies. And the most common presenting sign of rabies is also one of the most common emergencies we deal with, and that's colic. Horses with rabies can look like colic. And one of the first thing we do with the colic, we'll look in their mouth and check their mucous membranes, check for a toxic line, check their hydration that way. So knowing a horse is vaccinated for rabies can bring a lot of peace of mind to you as a horse owner and also to your veterinarian. And it moves rabies way, way down on the list. But they can also look like they have a foot abscess. They can also look like they are limping on a leg. They can look like they're sick. They can look like anything. We don't see the aggressive form or the vicious form, they call it, in horses that much, as far as you think a rabid dog, like trying to bite everybody. We usually get what's called the dumb form, where horses are just kind of depressed and lethargic, and they probably are salivating a little bit more because they can't swallow too good, or they'll be swallowing a whole lot. And the thing about neurological diseases is a lot of them in horses look the same. So if we see a neurological horse and it's not vaccinated for rabies, then rabies goes way up high on the list. And then the protocols for biosecurity become super important as far as wearing gloves and everything like that. So we'll talk more about that when we sit down with Dr. Helbig in a future episode. And one more thing I will say about rabies is the treatment for equine rabies is nothing. There's no treatment available. Like I said, 100% mortality rate. If your horse gets rabies, it's going to die. A very terrible death unless it's euthanized first, which is very dangerous to do. Most of them, to euthanize, we have to shoot them in the heart because we have to take their head for testing, and it's preventable too. So just vaccinate your horse for rabies. It works. It's preventable. And then I'll group together the West Nile, Eastern, and Western equine encephalitis together because those are all spread by mosquitoes, and they basically cause inflammation of the brain and inflammation of the spinal cord. That's the encephalomyelitis portion of it. And varying survival rates, but if they do survive, a lot of them have some permanent neurological signs. So again, preventable. I don't know where you're at in the country, but some places have mosquito season 12 months of the year, so a lot of those are getting more boosters than just once a year. As far as prevention, try to keep your mosquitoes down and vaccinate your horse. And that's about all you can do for these. And mosquitoes are very hard to control, as most of you know. I lived in town for a couple of years when I moved back, and the city actually used to fog because the mosquitoes were so bad. And I think a lot of that was certain people that didn't clean up their yard so much and had a lot of standing water, which is a great place for a mosquito breeding ground. Treatment for these three things, the West Nile and the two encephalitis, kind of like us if we get the flu or something, supportive care, IV fluids, NSAIDs, and it can be super expensive, anywhere from $2,500 to $20,000 to treat your horse for this, and it's preventable with a vaccine. And an interesting thing about West Nile is when it was first discovered, the cases were through the roof. Vaccines got developed. Everybody was scared to death of it, so they started vaccinating, and the numbers went down. So as the number of cases went down, people were like, oh, West Nile is not a big deal, so people quit vaccinating their horses. Well, guess what? The numbers started going back up again, and it's kind of been this whole roller coaster ride. Anywhere from when it started back, and all the way to 2020, I think there was only like 70 or 90 cases, but then nobody hears about West Nile and people quit vaccinating. So that's one great thing about Zoetis' core EQ is every horse every spring gets it, and then it's not a worry on our radar anymore. In tetanus, this is a scary one. There's an old picture of a guy having muscle spasms from dying of tetanus. I would encourage you to look up some tetanus pictures, and it'll scare you to vaccinate your horse. It's cheap. It's easy to do. Talk to your vet about it, but it's a Clostridium, and they get the bacteria from the soil. So a puncture wound or a cut, and even a foot abscess, that's a great route for tetanus to get in. So it's going to attack the central nervous system and cause a horse to get super stiff. We had 3 or 4 cases last year come through our clinic, and they're just terribly sad because a $10, $12 shot can prevent it. And again, the survival rates, they're close to 0%, about 100% mortality. So make sure you vaccinate your horse for that and booster it. It's not going to hurt anything to booster. We can't really over-vaccinate for it. Foot abscess, you want to booster them, any laceration, any cut, anything like that. Because treatment is very difficult and very expensive. And again, most of the time, by the time the signs are recognized, treatment does not do much good. And the antitoxin is, as far as I know, still currently unavailable. So according to Zoetis, a few years ago, about 400 horses die every year in the United States from a core disease. And that's a preventable core disease. So get your horses vaccinated. Every horse, every spring, just do it. Zoetis has got a product. It's 1 cc. It's one shot. Boom, you're done. Easy to do. There's a whole bunch of risk-based vaccines. Again, we mainly are talking about equine influenza and equine herpes virus or the rhinopneumatitis. There's also strangles, lepto, EVA, botulism, anthrax, rotavirus, Potomac horse fever. There's a whole list of other risk-based vaccines that with those, talk to your vet about them. If you're hauling a lot, certain areas of the country are more predisposed to certain things. I will briefly talk about equine influenza because that's something we take pretty serious and vaccinate all of our horses for. It's a super contagious disease, and it's transmitted from one infected horse to another. And they're kind of like us when we get the flu. You get a high fever, you can get some nasal discharge, a cough. And just like us, the first thing you do when you get a fever, like you don't feel like eating, you don't feel like drinking. When horses quit eating and quit drinking, that snowballs into some serious stuff. We'll see a lot of colics after an infection like this because they get dehydrated and get impacted, ulcers from not eating good and their stomachs being empty most of the time. And the crazy thing about equine influenza is your horse can get infected from up to 50 yards away from an infected horse. Half of a football field, the influenza virus can infect your horse. So even if you don't get real close to other horses at horse shows, if you're in the same area, your horse could be exposed. So just vaccinate your horse for influenza, and they can take forever to recover if your horse gets it, sometimes up to 6 months, depending on the severity of it. And then the herpes virus, it's equine herpes virus, or EHV 1 and 4 that we worry about. That's the respiratory forms, and there's also a 4 that can cause abortions, that there's and neurological symptoms, that there's not really a vaccine for that. But 70% of horses that are diagnosed with respiratory disease as EHV, 95 of those come from EHV4. And the symptoms look a lot like influenza. 70% of respiratory disease in horses are diagnosed as EHV. So 70% of the respiratory diseases we see are diagnosed as the equine herpes virus, and 95% of those are the EHV4, which we have a vaccine for. And companies like Zoetis and the other reputable companies stand behind their vaccines too. So if your horse is properly vaccinated and does contract one of these, most of the companies will pay for diagnostics and treatments anywhere up to $5,000 as far as I can remember. I know Zoetis is $5,000. I can't speak for the other companies. The other thing we do in our spring wellness packages is we run a fecal egg count, which is where we take a sample of your horse's manure, and we have a machine called the Parasite that actually gives us a fecal egg count, which tells us how many eggs per gram is in your horse's feces, and that can give us a really good idea of the worm load inside your horse. And what we're testing for is strongyles and roundworms. Strongyles are also known as bloodworms. They're developing some tests for tapeworms, although it's not really out or not really performed yet. But the small strongyles are the main parasitic pathogen in the adult horse, and they can cause weight loss, the poor hair coat, colic, diarrhea, fever. Some of the horses that are kind of stunted will have these things, but there are some really good dewormers out there, and knowing your horse's fecal egg count, knowing their burden, really helps guide us in deworming these things. Tapeworms are important too, although there's not a really good test for those right now. And then young horses, we worry about roundworms. These are the big spaghetti-like things that you may see your little weanling pass or foal, and these are the ones that probably cause the most problem that I've seen because they can get way overloaded in these horses. And it's not only important that you know they have them, but it's important you know how many they have or how much we think is in there, because different dewormers kill them differently. Some of them cause what's called a flaccid paralysis, so they get kind of like cooked spaghetti when they die and they can pass them easier. Some of the dewormers, they cause more of a rigid paralysis, and those worms kind of firm up and they can cause horses' intestines to get plugged up, and sometimes it takes surgery to get them rid of. So proper deworming, super important, these guys, especially the young ones. So get a fecal egg count, talk to your vet, and figure out what dewormer is best for you to use with your specific horse and what time of the years. It's also timing-wise, different parts of the country too. So, what I tell you for Southern Illinois may be different for Northern Illinois or Wisconsin or something. So, all of these things, the important thing to do is talk to your vet about it and get a plan that's set up and ideal for your horse. Again, we use a parasite machine in our clinic that gives us a fecal egg count. You can do floats, give you an idea, but you can also, if your vet doesn't have access to this, they can send it off to labs and have an actual fecal egg count done to see the burden. And then the other thing I'm going to touch on a little bit, which we'll dive deeper in probably several episodes coming up, is dentistry, which is, I say dentistry, not carpentry. And I say that meaning when we're doing dentistry on horses, it's not just floating teeth. Dentistry is a veterinary discipline, and it's concerned with the diagnosis and treatment of the mouth and the teeth and associated head structures. And dental disease affects the entire body. I don't know how many horses we've had come in, not to get on a soapbox, but older horses that choke. Oh, yeah, we just had his teeth done. Well, I look in their mouth and there's 6 loose teeth that need to come out. Or a dentist says he doesn't have any teeth left, even though he does, and they're causing significant pathology and pain, and they can be addressed. So it's not just floating those sharp points off. I can train a monkey to do that. It's the exam and recognizing any pathology and treating it before it becomes a major problem that's important. And sometimes we've got to take dental x-rays. Sometimes we're opening gaps in teeth. Sometimes we have to do some crazy things, but equine dentistry is part of that whole horse approach. There is an entire body attached to the head that you're letting somebody float the teeth in. So I think that's super important to remember when you have somebody come out to do that. And then I've seen another thing. I'm not trying to get too fired up, but there's a few people in the area that are doing it sedation-free. They're not sedating these horses. Oh, so-and-so, he doesn't even have to sedate horses. Well, that's terrible. That's not fair to the horse, because to do a good job, your horse needs to be sedated. To get a good exam, your horse needs to be sedated. So if you're paying somebody to float your horse's teeth without getting a good exam and without getting that horse sedated, then you're wasting your money. But on the flip side, it's also illegal for somebody other than a veterinarian to sedate your horse. So what a lot of these people are doing are illegal, no matter what the person tells you that doesn't use sedation. Sedation's safe if you know what you're doing. Like I said, we do a physical exam first. I make sure your horse is healthy and happy enough to handle the sedation that day. And if there is a very, very, very slim chance they have a reaction, we're prepared for it. And then they really need an oral exam. I've been to a few equine wellness days or client education things where they've had these equine dentist or somebody that's went and spent 2 weeks somewhere to learn how to file down points in a mouth, and they don't even look in there. And that's not doing justice to the horse. As a veterinarian, I'm an advocate for the horse. So please go to a veterinarian that's had a lot of training and is qualified to do dentistry. And please make sure that they're sedating the horse, because it's very essential. Because without dentistry, they can't chew their food good. Horses are good at hiding pain. If you ever bit your lip, you know how bad it hurts. And some of these horses we look in, they may not be showing too much on the outside, but their whole mouth is ate up with ulcers, and they got periodontal disease and everything like that. So it's just super important to take your horse to a vet that can do a good job with their teeth and do a good exam and treat any problems that come up. Because it wasn't too long ago we had a phone call. Of course, it was a Saturday, a horse that had a fever. So what's going on? Well, the dentist took out a tooth, which is illegal if they're not a vet. But they said he didn't need antibiotics. Well, that's because they can't prescribe them. So I'll get off my soapbox now, and we'll do a whole episode on equine dentistry and some of the pitfalls of the state of that. And the last thing we'll do before your horse leaves, we'll do a Coggins test of the equine infectious anemia, which is a potentially fatal bloodborne infectious viral disease that comes from biting flies. Super rare. Knock on wood, in my 12 years of practice, never had a positive. I've had a couple I worried about, but there's really no treatment for it. and then it's kind of like a really, you can kind of think about it as like HIV for horses. They'll get fever, they're weak, they weight loss, depressed, they're just super anemic. And there's no vaccine, there's no treatment. And if they get infected, they're lifelong carriers. And positive horses have to be quarantined and isolated and like 200 yards from any horses forever. And most of them are eventually euthanized. So it's important that we do test every year for these horses, sometimes more often depending on where you're going or where you've been. So don't forget the Coggins. If your horse isn't traveling and not exposed too much, then maybe you don't need it. But it's always good to have peace of mind, or on the unexpected event. You do have to move your horse. Something happens to you and somebody's got to take it. It's there. They're pretty cheap. So just get your Coggins done every year. So that's kind of our spring wellness package. And we, like I said earlier, the sheath cleaning if they're geldings. But it's a great time, an annual exam, especially if you're waiting on the sedation, waiting on the fecal to get done. It's a great time to discuss with your vet any concerns, diet, anything like that. So schedule an annual exam with your horse, get that relationship with your vet so he's there when you need him in an emergency, and do what's right to your horse. And shout out to John at Just Say Hey for letting us use his studio today. And until next time, take care of your horse and yourself.
Veterinary surgeon or start to come quick. Draw the syringe and give it a flick. Bring your little black bag with the medicines in. Bring the trank and the crank and the penicillin.